Lander, so he's not far from home. And when he isn't working, he enjoys snowboarding, camping, hiking, and spending time outside with his Cocker Spaniel. What is your Cocker Spaniel's name?
His name is Hans.
His name is Hans, okay. Well, with that, I'm going to turn. So thank you.
All right, thank you for that introduction here. I'm just gonna get my screen shared. All right, and can everybody see this okay?
Yes, you're good right now. Yep.
Okay, perfect. All right, well, yeah, I'm super happy to be here and talk about vitamins, herbals, and supplements with you all on this afternoon. I think this is a very valuable topic and applicable as these as supplements are used in a lot of cases, and a lot of people do take these. So I think it does warrant a good discussion about these, and probably even a longer discussion than the hour that we have today. But today we'll just kind of talk about just some general information about the common herbals and supplement medications that are frequently used. So the majority of this presentation will be covering the herbals and supplements section. So we'll kind of just dive right into this. So herbal supplements are frequently taken for cultural purposes. You know, supplements are natural, so there's a common belief that natural things might be good or helpful or beneficial for us. Kind of as I mentioned, you know, since they are natural, there's a perception that they're good for you, which in some cases is true. Patients might be taking supplements if they don't like the side effects of medications that they're currently on, and they're maybe seeking an alternative therapy that might be more effective for themselves. Also, cost can be an issue for some prescription medications, so supplements might be attractive for patients who might be seeking alternative therapy and seeking some cost savings benefits. And also, patients may be seeking alternative therapy for medications that they have not found to be effective. So that's another potential option for supplements. I think this slide is very important to talk about as it kind of distinguishes the differences between herbals and supplement medications, and then prescription medications, which are FDA regulated. So the FDA classifies herbals and supplements as dietary supplements, so they don't necessarily undergo the safety and efficacy testing that prescription medications undergo before they're available on the market for patient use. So this said, there's no guarantee that what the supplement label says is what's actually in the supplement, or that the supplement is necessarily free of contaminants, which can be a little bit concerning. But caveats to this include that manufacturers can volunteer or pay to undergo additional stamps of approval. So some supplements that are actually tested or undergo good manufacturing practices include supplements that are labeled as USP certified, which is the United States Pharmacopoeia, or NF, which is National Formulary. And what these stamps really mean is that there is more consistency within the supplements, as well as that they're tested for any harmful chemicals or toxins or anything like that. So supplements with these stamps are definitely better options. And then the most rigorous of these additional tests that manufacturers can undergo is the consumer lab certification, which again, this tests for consistency, potency, and purity of the supplement. So if a supplement has the consumer lab stamp on it, it means that it's a pretty good supplement, and that it's at least what the bottle says it is what the supplement actually is. Furthermore, supplement companies cannot make direct claims for health benefits for supplements. A good example of this would be for cranberry supplements. Manufacturer of cranberry supplements could not say on the bottle of their supplement that this cranberry is used to treat urinary tract infections. Rather, supplements must use more like supportive health claims. So that's why you'll see a lot more phrasing like this cranberry supplement is used to support urinary tract health rather than actually treating a condition. And then finally, a very important note is that the FDA really only regulates supplements when there is patient harm. So again, since supplements don't necessarily undergo that initial safety and efficacy testing, really the only studies or reports that are built on some supplements is after the supplement has already reached the market. So if there's reports of harm from patients receiving supplements, then the FDA will actually intervene and potentially pull the supplement from the market or reach out to the manufacturer to resolve any issues. And then I guess just also looking at some potential concerns with herbals or supplements. We kind of touched on some of these, but again, there is a chance for some contaminants, but with some of those stamps of approval, such as USP or NF or the consumer or the CL stamps of approval, those should be safe and tested as they're not shown to have contaminants. And then the standardization between supplements isn't necessarily recommended. So between supplements or even with a specific type of supplement, an example could be like garlic. Different types of garlic have different strengths or different potencies. So even depending on the part of the plant that is used for different supplements, whether it's like the root or the leaves or the seeds, all of them can have different amounts of active ingredients, which could create variations between different products. So they're not necessarily standardized. And supplements can have adverse effects. So, just because they're a natural product doesn't mean that they also can't cause harm to ourselves as well. So some concerns can include cardiotoxicity, or like heart toxicity, liver toxicity, neurotoxicity, or kidney toxicity. There are some concerns with drug interactions as well. I think one that we'll be highlighting a lot are blood thinner medications, particularly warfarin. Warfarin is a blood thinning medication used to prevent stroke or blood clots in certain patients. And it does have a lot of drug interactions with prescription medications, and that doesn't necessarily change with herbals and supplements, which can also interact with this medication and increase your risk for clots or bleeding, which is something that we definitely want to avoid. And then finally, with regards to some of the studies and literature that looks at supplements, there are some concerns about the quality of data that are out there that look at supplements, because there is known to be a publication bias with a lot of studies and literature that support supplement use. A lot of articles that are published are published. A lot of the positive articles are published, but some of these studies that have shown potential like negative benefits for supplements maybe were not published. So that's something to consider too going forward. So in general, I think if you're interested in looking at taking supplements, or if I'm recommending a supplement for a patient, I think it's really important to do an individual risk versus benefit assessment. So with some of the supplements, we'll kind of be talking about some adverse effects or drug interactions or evidence that supports their use, and it's kind of just weighing is this a good supplement for you? Because there could be some benefit from it, but there could also be harm. So it's really just trying to weigh which one is going to be more heavy. And if you're going to be having more benefit from a supplement, then it might be more appropriate to take. It's also really important to inform your healthcare provider or pharmacist if you are starting supplements, as it's good for us to keep an updated medication list. As I previously mentioned, some of these can have adverse effects as well as drug interactions, so it's helpful for us to keep an eye on those things and that we're aware of everything that you might be taking. Also for supplements, for most over-the-counter products, really important to read the product labels and follow the instructions and dosing on those labels. And it's also primarily recommended to use herbal products for more minor conditions and only for a shorter duration of time. A lot of studies for supplements don't necessarily look at long-term use of them, so their safety or effectiveness past certain periods of time is less known. And it's also important to discontinue a supplement if you experience any adverse effect as well. And then, as I previously mentioned, pharmacists are great resources your community pharmacist is always happy to answer any questions that you might have about supplements and review your medication list to make sure that there aren't any significant drug interactions prior to starting one of these. So I just provided a brief overview list of commonly used supplements, and we'll kind of dive a little bit more in depth on each one of these going forward into the next slides. But there's ginseng, Ginkgo biloba, garlic, glucosamine, St. John's wort, echinacea, chondroitin, or saw palmetto. And we'll kind of talk about their uses and stuff on the following slides too, so we won't dive into that really on this slide. The first supplement that we'll be talking about is fish oil. So it's a natural source of essential omega-3 fatty acids. And really, most fish oil supplements contain 2 long-chain fatty acid ingredients. And these include EPA and then DHA. So ultimately, fish oil is commonly used because of its cardioprotective effects, which we'll talk a little bit more on the next slide. So fish oil is, again, used for cardiovascular disease, decreasing triglycerides. Some patients do also take it for like improvements in psoriasis symptoms or improvements in symptoms and decreasing the use of over-the-counter pain medications such as like ibuprofen or naproxen for rheumatoid arthritis. So the fish oil does have some like anti-inflammatory properties in addition to some of the cardiovascular benefits that are seen with it as well, which is where its theoretical benefit comes in for those patients with rheumatoid arthritis. Some adverse effects do include fishy breath, belching, or GI upset. Otherwise, it's pretty well tolerated. And then it's recommended to not use cod liver oil as a source of omega-3s, as cod liver oil actually contains high amounts of vitamins A and D, which we'll talk a little bit more later, but these 2 vitamins are actually vitamins that we can take too much of, which we would like to avoid. Fish oil does have some additive effects with blood thinning medications as well as blood pressure medications. So it is important to consider that before taking, just to make sure that we're not increasing our risk for bleeding too much or that we're not decreasing our blood pressure too much either. And there actually are 2 prescription fish oil products on the market now too. One is Vasipa, and then the other is Levosa, I believe. But it's interesting to note that Vasipa is actually a fish oil product that contains EPA only over the DHA. And I think I actually talk about this a little bit on maybe the next slide. But so for fish oil products that do contain higher amounts of EPA, there might be a greater benefit for its cardioprotective effects. So that's something to consider, and I think I'll actually mention on the next slide too. But the American Heart Association does have recommendations for omega-3 fatty acid intake. So people with chronic heart disease really recommended to just have dietary intake of omega-3s, whether it's oily fish or foods higher. Oh, I think I got booted from the meeting here.
Nathan, I can still hear you and I can still see you. Susan, can you just confirm that you can also see Nathan?
I can see, yeah, I can see Nathan, but I'm not seeing his presentation.
Okay.
I think I'm back. Can you guys hear me now?
Yes.
We can hear you and we can see you.
Oh, okay, excellent. I think my internet just kind of cut out just for a second. So
Okay.
sorry about that, guys.
I can see your presentation again. You're good to go.
All right, thank you so much. So the American Heart Association does provide recommendations for omega-3 fatty acid intake. So for people without chronic heart disease, really recommended to focus more on just dietary intake of omega-3s, so oily fish or foods higher in ALA, which is also an omega-3 that's kind of converted into some of those supplemental omega-3s within our body. And then for people with chronic heart disease, the American Heart Association does recommend 1 gram of the EPA plus the DHA every day. And then for people with high triglycerides, recommending higher doses of the EPA and DHA ingredients. So it's kind of confusing when we talk about EPA and DHA, but we'll kind of look at this ingredient label here to hopefully try to clear some of that up. So this is just a supplemental facts information from a fish oil supplement. But as we can see, I'm not sure if you can actually see my mouse on the screen, but kind of towards the bottom here, the bottom of this supplemental facts is the fish oil concentration, which is listed at 2,400 milligrams, and then it breaks it down further into the EPA and DHA content. So in total, there is 600 milligrams of the EPA and DHA. So if we're shooting for a 1 gram dose daily, we're actually going to want 2 servings of this to get a little bit over 1 gram or 1,000 milligrams. So when we go up to kind of the top of the supplemental fact, we see that a serving size is 2 soft gels. So within a day, we're actually going to be taking 4 soft gels in total to get that, that 1 gram recommended dose for patients with chronic heart disease. So now we'll kind of move into talking about garlic. So garlic is used for helping to reduce blood pressure or potentially for cardiovascular benefits, as well as antioxidant properties. There are lots of different forms, and all the different forms do have different amounts of the active ingredient, which is allicin. And allicin is actually broken down through a lot of different things. One of them is heat or cooking. And then the active ingredient within garlic, that allicin, can also be broken down from our stomach acid. So a lot of these products are what's called enteric coated. So it's recommended to use an enteric coated garlic product if you're going to be taking this, as the enteric coating kind of protects the garlic while it's in our stomach, protecting it from that stomach acid, so the active ingredient remains active. And then once the drug reaches our small intestine, then it'll be absorbed more efficiently with more active ingredient. So most studies use a dose of about 3.6 to 5.4 milligrams of allicin daily. And just for your reference, a garlic clove has about 5 to 9 milligrams of allicin. But a lot of garlic capsules and extracts are more concentrated. So you're definitely not going to be taking pills or anything like that the size of a garlic clove, which is good. Furthermore, their higher doses have not shown any improved response with this, so recommended to stay within the dosing listed above. And then garlic can increase our bleeding risk, as well as cause increased heart rates, as well as facial flushing, difficulty sleeping, and it can also interact with other medications. But really the biggest concern with these side effects is probably mostly the bleeding risk. So just something to think about if you're on other blood thinning medications. The next supplement we'll talk about is ginger. This is commonly used in cooking or spice teas and baking. So it's commonly used more so for motion sickness or nausea and vomiting after procedures. There is some evidence to support its use for this. For patients who might not be able to take prescription nausea medications, this could be a good alternative in this case. And it is also, there is also evidence for using this supplement for nausea and vomiting associated with pregnancy, but really recommending to stay around the dose of 250 milligrams 4 times daily and avoiding larger doses. Some people do take it for like osteoarthritis, although there's not necessarily a lot of evidence for its use within osteoarthritis, and there are other supplements that might be more effective for that indication, which we'll be talking about in a little bit. Overall, ginger is generally well tolerated, can cause mild heartburn, and then this one can also increase our risk of bleeding a little bit, so important to consider this if we're on other blood thinning medications as well. Next, we'll talk about soy. The primary ingredient within soy is isoflavones, which is similar to estrogen, essentially. So its uses are primarily for helping to reduce our bad cholesterol within our body, which is our LDL. It can also be used for menopausal symptoms or postmenopausal bone loss because it does have that active ingredient that kind of works similar to estrogen. This said, it's important to note that because it has the estrogen component, we want to avoid this or you would like to avoid this for if you have increased risk or a history of breast or uterine cancers, as estrogen can kind of feed into some of those cancers, and we would really would want to avoid this medication in those people. So soy, or the active ingredient, can interfere with tamoxifen and estrogen therapies, as well as thyroid replacement or anti-thyroid therapies. So some soy products are listed here. Ultimately, like the soy milks generally have like less soy, as well as like some of the concentrate or some of the powders also have lower amounts of soy in comparison to the actual like soybean or potentially even like tofu. But the recommended dose would be 60 to 80 milligrams of that isoflavone dose, or just about 20 to 50 grams of soy protein daily. Here we do have a supplement label kind of on the right side of the screen, which has in this yellow section, it has the soybean extracts, which is 1,000 milligrams shown here. And then when we actually look kind of in the print below that, it recommends the 25, or it has, there's 25 to 35 milligrams of the active ingredient within the serving size. The next supplement that we'll talk about is traditional red yeast rice. This product was probably a little bit more popular in the later 90s. And at that time, it actually contained a more active ingredient, which is now a prescription medication. So the older red yeast rices contained what's now known as a medication called lovastatin, which is a medication used to lower our cholesterol levels. And then essentially when the FDA realized that the supplement had this, they kind of cracked down on the supplement a little bit more, and ultimately kind of mandated that the supplement doesn't have this active prescription ingredient within it anymore. So now most red yeast rice products do not have the active ingredient of lovastatin in them anymore. So that's important to note, because if we are using this for lowering cholesterol, it's not going to work as good because it doesn't have that active ingredient essentially within it. However, some products may contain some amounts of that lovastatin within it. So if this is something that you are taking, it's actually recommended to stay within or keep taking that specific manufacturer of that supplement, as the active ingredient amounts can vary between manufacturers. So it's important to stay consistent with one manufacturer to make sure that you're getting a consistent dose. Since it does potentially have some amounts of an active prescription in it called lovastatin, it would be contraindicated in pregnancy and lactation, or those wanting to become pregnant, as lovastatin, as well as the statin medication class itself, is contraindicated in pregnancy, as it can cause some fetal harm. And then some adverse effects could include muscle pains or harm to our liver. Next, we'll talk about valerian, and this is essentially the herbal formulation that's commonly supplied is actually the root of the plant, but it's really used for its sedative and anti-anxiety effects. So it's primarily used for things like insomnia or anxiety. Of note, it doesn't have like a common like hangover effect like some prescription insomnia medications might have. So it doesn't cause quite as much like next day drowsiness after taking it the night before, which can be beneficial. This said, since it is kind of acting as a sleeping agent or as sedative, we do want to avoid this in medications that could also increase drowsiness or dizziness. So that would include other alcohol or other sedating medications. Some adverse effects include uneasiness, cardiac disturbances, nausea, dry mouth, vivid dreams, blurred vision, or morning drowsiness. All right, now we're going to talk about melatonin, which is a naturally found hormone within our body. And ultimately, the formation and release of melatonin is stimulated by darkness and then inhibited by light, which is important to note because if you are taking this medication for sleep, it's important to take it like right before bed when the lights are off, because if you take it and then you kind of hang out, in a bright room, the light can actually inhibit the medication. So it's kind of a weird thing where you actually do want to take it like right before bed. But melatonin does also act as an antioxidant as well. And there is some interesting research that's kind of ongoing that does potentially maybe show some benefit in helping to inhibit cancer cell growth. Although a lot of that is pending and most of it's on like animal studies or outside of the body, it is still interesting. So probably more to come on that in the future. It can be used for jet lag as well as insomnia. Again, just taking it at the time we're trying to go to sleep is really most beneficial. And then it is beneficial in that it doesn't cause drowsiness like prescription sleep agents do. So. All right, so now we'll talk about St. John's wort. So this is a yellow flowering perennial plant, primarily used for mood, whether that's depression or seasonal affective disorder. There is some evidence that support its use for more mild or moderate depression cases, but it's really important to note that if you are experiencing any feelings or thoughts of depression, that it really shouldn't be self-treated, and this should be a further discussion with your primary care provider rather than trying to self-treat is what's recommended. So some patients may take it for other conditions like OCD or polyneuropathy, although there isn't a lot of supporting evidence for this. And then another really important reason to talk about this medication with your primary care provider or your pharmacist is that there is a lot of drug interactions with this medication, as this medication kind of makes our body a little bit more active at breaking down certain medications. All right, next we'll talk about Ginkgo Biloba, which is an antioxidant and anti-inflammatory herbal supplement. Its use is primarily for improvement in mild symptoms of dementia or helping to stabilize or slow the decline for moderate or severe dementia. And then some patients may also take it for memory, although a lot of studies haven't shown any difference for patients who take it for memory or those who don't. There haven't been really any differences noticed. And then there are also other uses for it, although the evidence for those is not very strong. So vertigo or tinnitus is also some people might take it for that too, but there are drug interactions with this with our blood thinning medications, as well as a lot of antidepressant medications as well. All right, now we'll kind of talk about tea tree oil, which is more of a topical herbal supplement, but it's essentially made from crushed leaves from trees in Australia, or a particular tree in Australia. And it's usually a clear to yellow oil. It does have a nice smell to it, or a smell of camphor, or like menthol, or kind of minty smell to it. There is evidence for its use in like acne or dandruff or athlete's foot or nail fungus. Although if you're using it for athlete's foot or nail fungus, the amount of tea tree oil or the concentration of the topical agent that you'll be using for those two uses is going to be a lot more than that of acne or dandruff. But overall, it's pretty well tolerated. There can be some skin irritation associated with it, or skin drying or skin burning as well. I've just provided some additional images of what you might see with tea tree oil products. Now we'll talk about ginseng. There's a lot of different types of ginseng. I think there's like 11 different types, so I'll kind of just focus on the 3 most common ones. But ginseng itself is known as like an adaptogen. What that really means is that it's used to help kind of stabilize our normal body functions. So kind of a general definition, and there's a broad range of proposed benefits, and it does vary depending on which ginseng product that is being used. So first there's American ginseng, which is kind of used more as a stimulant or for improving stamina, can be used for diuretic or memory. It is commonly used in energy drinks. So if you do drink any energy drinks or anything like that, you might see it on the supplemental facts of that energy drink. There is also Chinese ginseng, which athletes may be taking more of in particular, as this is mainly used for like improving physical and mental stamina, improving cognitive function or depression and anxiety. And then finally, there's Siberian ginseng, which is a little bit different than the others, as it has more like immune system type effects, where it might be used more so for like common colds or herpes. And then it also does cover some of the other things that we talked about too. So kind of the stimulant effects, or helping with energy, or as a diuretic, or helping with blood pressure. So with ginseng, it can cause some trouble sleeping, increase your heart rate, or cause abnormal heart rates, as well as maybe changing your mood a little bit too. Now we'll look at black cohosh. This is a flowering plant that has anti-inflammatory or pain management effects. It does also have an estrogen kind of component to it as well. So it is kind of similar to soy in that aspect. So it can be used for symptoms of menopause, although the evidence, there is some evidence for it reducing symptoms, but there isn't necessarily long-term evidence for its use for preventing bone loss. And then it can also be used for PMS as well. Again, since it does have that estrogen component and it hasn't been studied in patients with breast cancer, it would be recommended to avoid this agent for patients with a history of breast cancer or uterine cancers, as again, we just want to avoid the estrogen for those patients. There is some concern for misidentification of plants for this supplement. So again, just recommending to, if this is something you're interested in taking, to take it from a trusted manufacturer would be ideal. Some adverse effects include rash, dizziness, hypotension, and weight gain. All right, now we're going to look at cranberry supplements. So cranberry works by kind of inhibiting or stopping bacterial's ability to stick to our cells. So its uses are really for urinary tract infection prevention. And that is a plausible use for this, as we do want to try to limit or avoid as many antibiotics as we can. So this can be beneficial for you if you do have recurrent UTIs. Of note, there is a large amount of sugar in juice, so if if we're trying to limit sugar, it's recommended to maybe more so go towards a capsule extract formulation of cranberry to try to reduce the amount of sugar that we're taking. But ultimately, cranberry isn't a substitute for antibiotics if you have like symptoms or signs of an active infection. And then it can also cause some diarrhea with larger doses, as well as cause uric acid to build up within our kidneys if we're at higher doses, which could result in stone formation within our kidneys. And there are more so limited in interactions with cranberry, so not really anything significant to note with that. Now we're going to look at salt palmetto. This is a supplement that's used to improve urinary flow or reduction in painful and frequent urination, or decreasing nighttime urination for patients with benign prostatic hyperplasia, or BPH. So just treating or helping to manage enlarged prostate is really its primary use. Studies have shown some benefits with it, with improving some of those symptoms. So it could be a plausible option or an option to discuss with your primary care provider. It does also have some anti-inflammatory and anti-proliferative properties, but it does have interactions with blood thinning medications as well as over-the-counter pain meds such as ibuprofen or naproxen, where it can increase our risk for bleeding with some of those medications as well. If this is something that you are taking or interested in taking, it can take up to 1 to 2 months before you see any benefit with it. And some side effects do include more gastrointestinal effects or intolerance, so like upset stomach or dizziness, and then kind of, as we mentioned earlier, that increased risk for bleeding. All right, next we'll talk about echinacea. So this is an agent that is primarily used for its anti-inflammatory effects or antiviral or antifungal effects. A lot of times people will take it for like common cold or respiratory infections. However, it's not really a great standardized product, so you might get a lot of variation between the different products that you might buy from this. And then there's not a lot of great evidence that support its benefit, but it is actually pretty well tolerated. Glucosamine is a supplement that is found within our cartilage, and it's used for our body to build our cartilage between our joints. So it's really used to help slow down the joint breakdown for patients with osteoarthritis. It can also help potentially reduce pain as effectively as over-the-counter pain management, but it's really not effective in advanced osteoarthritis or in elderly patients or in overweight patients. It does have a pretty favorable safety profile and is pretty well tolerated, although it can increase risk for bleeding. And it does also take a few months for any benefits to be seen with taking this. Chondroitin is also a supplement or herbal medication that's used for osteoarthritis, although typically we would want to recommend glucosamine prior to chondroitin, as glucosamine does have more evidence supporting its use, but it is also an option to take in addition to glucosamine. So we'll talk a little bit about cannabidiol or CBD, as this is now commonly found in a lot of different stores. But CBD is essentially like the non-psychoactive component of the plant cannabis sativa, or commonly known as marijuana. So it doesn't have the euphoria or the high effect associated with it, as CBD products are required to have very, very low traces of of THC, which is the component of cannabis, which has some of those more high-like effects associated with it. So CBD is commonly used for pain, insomnia, or social anxiety. The dose is recommended, or the most common dose that I came across within my research is 200 milligrams or less for up to 13 weeks is what's recommended. There are higher doses at shorter durations, but recommended to start lower on the dosing side of things and see how you can tolerate the medication and go from there. It can cause some drowsiness or upset stomach or diarrhea or dry mouth. It does potentially have some rare side effects that it might be a little bit more severe, but more so on the higher end of the dosing scale is when these side effects have been reported, which include harm to our liver or increased heart rate. It does have drug interactions, so it's important to bring that up with your primary care provider or pharmacist. So there are interactions with seizure medications, antidepressants, and warfarin. All right, so we'll talk a little bit about probiotics as well. So the concept of probiotics is to supply our gastrointestinal tract with healthy bacteria, which kind of help fend off bad bacteria that is bad for us or could cause like an infection. So if we have enough healthy bacteria within our gastrointestinal tract, it can kind of help prevent certain types of other bugs from getting in there. So it can be used for traveler's diarrhea, where we start a couple weeks before traveling and then continuing about a week after. And then there are different probiotics, and some of them have like a single bacteria within them. Others have like a blend or multiple bacteria within the probiotic. And then probiotics are also commonly used in addition to antibiotics. So it's, again, the antibiotic could potentially clear out our good bacteria within our GI tract, and then open up an opportunity for bad bacteria to grow more and cause problems. So the probiotic is really there to help prevent that. But if you are using it in addition to an antibiotic, it's recommended to take 2 hours from your antibiotic. It doesn't really matter if you take the antibiotic first or second, but just separating the probiotic from the antibiotic by 2 hours. Otherwise, the antibiotic will probably just kill all the bacteria in the probiotic, and it's not really going to do anything. All right, so now we'll kind of move on to talking about vitamins and minerals, which, yeah, we'll talk a little bit, not quite as in depth as herbals and supplements, but yeah. So with vitamins, we can kind of break them down into like our water-soluble vitamins and then our water-insoluble vitamins, commonly referred to as lipid-soluble vitamins. But for our water-soluble vitamins, we have our B vitamins. So B1 is thiamine, B2 is riboflavin, B3 is niacin, B6 is pyridoxamine, B9 is folic acid, B12 is cyanocobalamin, and then there's also pantothenic acid and biotin. There is also vitamin C, or ascorbic acid, which falls within the water-soluble vitamins. But the B vitamins that we mentioned are referred to as essential vitamins, as they are needed for our normal physiological, our normal functions for our body to live. So they are very important vitamins. And then of note, thiamine can be used for patients who have poor nutrition, or for more commonly for patients who drink a lot of alcohol during the alcohol withdrawal process. It can be used for a certain problem that can occur from that, which is called Wernicke's encephalopathy, which is kind of like a swelling of our brain. So kind of looking more at some of the other B vitamins, we have niacin, which can be used to help lower cholesterol or triglycerides. A really common side effect with niacin is flushing, and this can be pretty bothersome for some people. So to help kind of prevent that, it's recommended that if you are taking niacin, to take it with food. You can take an aspirin dose prior to your niacin dose to kind of help with some of those flushing side effects, and then also avoid taking it with any like hot drinks or liquids. For pyridoxamine, or B6, this can be used to help prevent some neurological or numbness effects associated with some drugs. And then there is also folic acid, which is beneficial for patients who have anemia, as well as it is an essential prenatal vitamin. And then there's also cyanocobalamin, or B12, which is helpful for people with anemia as well. Kind of moving on to the next half of the vitamins is the fat-soluble vitamins. So we just kind of went through our water-soluble vitamins. And then the fat-soluble vitamins are vitamin A, D, E, and K. And these are also essential vitamins, so important for our body to function appropriately as well. One of the key differences between the water-soluble and the fat-soluble vitamins is that the fat-soluble vitamins can accumulate in our body if we're taking too much. So we do want to be a little bit more careful about how much of these we're taking to make sure that we're not taking too much and then having harmful effects from it. Versus the water-soluble vitamins, if we're taking a lot of them, since they're water-soluble or they'll dissolve in water, you can actually just pee a lot of that out. So if you do take too much, it's not as concerning with the water-soluble vitamins like vitamin C or the vitamin Bs. When we look at minerals, I think my screen just backed out again. Can you guys still hear me okay?
Yeah, we can still hear you, but your screen did disappear for just a minute.
Okay.
Looks like the same thing happened. There we go. And you're back. Go ahead.
Oh, sorry about that, guys.
No problem.
All right, so some common minerals that you might see in like multivitamins do include like copper, zinc, iron, magnesium, potassium, or sodium. There's a lot of different others, but we'll kind of just focus on a couple more important ones. But ultimately, it's important to talk with these about your primary care provider or physician as well. But usually multivitamins cover about 100% of your recommended daily doses for a lot of these minerals. It is important to note that some of these can actually be harmful. So if we do get too much potassium, or magnesium is another one, that can actually cause harmful effects for our body. So it is important to be taking the appropriate amounts of these. Iron is also another mineral that we want to avoid taking too much of, as this can also cause harmful effects as well. More specifically, looking at the mineral zinc, zinc has been historically or commonly used for helping to shorten the duration of common cold. So there is some evidence that suggests that taking zinc after having symptoms of a cold does increase the duration of these symptoms by about a day, give or take about a half a day, but it doesn't necessarily affect how severe of disease or how severe your symptoms of the cold are. So there's not really a super significant benefit for its use, but it's probably not necessarily harmful either, though. So it's kind of that risk versus benefit assessment. And then it is also found in like topical formulations for like sunscreens. Calcium is another very important mineral. So it's important to replace the calcium that we lose to support our bone health. Ultimately, food is really the best source of calcium. So found a lot in dark green vegetables or dairies. Otherwise, there are also products that are fortified with calcium as well. But it's important when we're looking at food labels to look at the amount of elemental calcium within it. Because the goal dosing that we're shooting for is about 1,000 to 1,200 milligrams of elemental calcium a day. And then as we can see within this table, I kind of just broke it down between women and then men, and then recommended daily calcium requirements. So as we can see, for women aged 50 and younger, recommended to take 1,000 milligrams of calcium daily, and then for women 51 and older, a little bit higher doses of calcium at the 1,200 milligram daily dose. For men, it's a little bit more lenient. So for age 70 and younger is that 1,000 milligram daily dose is recommended. And then for 71 and older is the 1,200 milligram dose. It's important to split these, your daily amount of calcium, up into separate doses, as our body can really only absorb about 500 to 600 milligrams of calcium in each dose. So just important to, if you are taking 1,000 milligrams of calcium, maybe do 500 milligrams in the morning and then 500 milligrams later in the afternoon. Vitamin D is used to help get calcium into our body. So the daily recommended dose, unless prescribed by your doctor, is about 400 to 800 units per day. Other alternative sources do include sunlight, although that is a rare commodity around these parts for parts of the year, so it can be difficult to obtain the vitamin D during winter here. And then there is also vitamin D within fatty fish, milk, or fortified products. Vitamin D does sneak into a lot of other vitamins and supplements, so if you're taking a lot of different supplements and vitamins, wouldn't be a bad idea to look at the supplement bottles to make sure that you're not taking too much of this. Again, our daily requirements for women and men under age 50 are 400 to 800, and then once greater than 50 years of age, that daily recommended requirement increases up to 800 to 1,000 units. Okay, so that's kind of everything that I wanted to kind of touch on. I know it was a lot of information, but I would like to open the remaining time that we have for any questions or comments or discussions that you guys might have. But I know it's a huge topic, and I'm sure there are a lot of questions. So,
Nathan, you have a moment to take a drink of water or something, because you have been on, yeah, you really went through a lot, and there's a lot of wonderful information that you provided. So thank you so much, Nathan. I do see that somebody has their hand raised, and it looks like it's Dave May. So Dave, you can come off mute and talk to Nathan, ask him your question.
I had a comment about overuse of the fat-soluble vitamins, and like vitamin D is one that I way overuse. What are the risks of that?
So yeah, with vitamin D, I mean, I guess as far as like the specific risks, you know, off the top of my head, I'm not sure what that could actually cause, but, you know, we would definitely want to stay within our recommended daily limits. So I guess that would be my recommendation. You know, look at all the products that we're taking and really try to make sure that we're eating too much.
Thank you.
Okay, thanks, Dave. Kay, you are next. Go ahead and unmute yourself, please.
Hi there, this is Kay Grueling, and I'll just give a little disclosure. So I am a family physician. So my question is, or my comment / question is, I know way back in the 90s already, when I went to some conferences on herbals and vitamins and stuff, there was a lot of discussion, and there was a pro supplement person and a not pro supplement person who had done a study together and found that many of the, sorry, my COVID long haulers, that many of the substances, many of the products that are sold actually have a lot of contaminants in them, but more importantly, the things like ibuprofen, Tylenol, that those things are added without anyone knowing it because they're unregulated. There's no regulation whatsoever. And that also the dosage, so let's say it's Palmetto, that it's 3 times the dose in one pill and it's half the dose of what it says in the other pills, because again, there's no regulation. Have you seen anything like that? Because I was pretty particular in which brands I would recommend historically because of that, ones that had a pretty good track record.
Yeah, that's excellent points, and a key part about herbals and supplements that we want to consider. So I particularly haven't necessarily personally seen anything significant like that. But if I were to recommend a supplement or herbal medication to patients, I would really try to get it from a trusted manufacturer that has some of those additional stamps of approval, such as the USP certification or the National Formulary or the NF certification, as those manufacturers voluntarily undergo these additional tests to ensure good manufacturing practices and at least have a little bit more consistency. With regards to like some products that do that, I haven't practiced retail pharmacy in a little bit, but and I don't want to support one brand over the other. But I know some of like the Nature's Bounty, I think do some of those additional testings, but usually they're stamped pretty clearly on the supplement bottle if they do undergo those additional tests. And those would be the ones I would recommend to avoid some of those other additional things that might sneak in the supplement. So.
And I'd like to interject though, I would definitely do that. And even if they're from GNC or Walgreens or Walmart, you know, or whatever CVS, that still doesn't mean that they're necessarily good, because that study I was referring to, they pulled it. This was the Twin Cities area, and they pulled it from the mom and pop Chinese herb stores, and they took it from GNC and all these other places. So I'd really use the labeling, the stamp of approval guidelines that he mentions, because, for instance, if you have ibuprofen, in something and you're on a blood thinner already, it can make your blood, exceedingly thin and cause strokes and stuff. And our poor Nathan, he hopefully doesn't see too much because he is in the bowels of the hospital. But I would just do that. And to follow up on whoever mentioned the calcium one, depending on your circumstances, you can take more calcium than what he listed on those. Those are standard ones, so they're not for people who, like some people who already have osteoporosis or thin bones, they may be taking some extras, but if you have a history of kidney stones, you might not be able to, so you really should talk to your provider about that. So thank you.
Thank you.
Thank you, Kay. Thank you. Go ahead. You can take mute. Yep, you're already off mute, so you can just ask your question, Terry. Do you have a question?
Yeah, what's the difference when you see vitamins that are either carbonate or citrate? Like I take a calcium citrate only because my doctor recommended it.
Yeah, so that's a really good question. There is a little bit difference between the calcium carbonate and calcium citrate. They both have calcium, but the carbonate and citrate is kind of just the way the medication was made. So it's what's called a different like salt formulation. There really isn't a lot of differences, but essentially the two key things are that calcium citrate might be a little bit more tolerable from what I recall. It might have less side effects like constipation would be a big one with calcium carbonate. So that's why I've kind of commonly seen it recommended over calcium carbonate, but calcium carbonate is cheaper and there is actually more calcium within the calcium carbonate. So, yeah.
My other question is, have you ever heard about fish oil containing lead?
That is not something that I have heard of, but
I was told to get some fish oil that is distilled or lead-free.
Yeah, I personally haven't heard of that, but we would definitely want to avoid that if that was the case. I would hope a lot of the supplements would be lead-free. I guess for fish oil, potentially I could see where maybe if it was obtained from fish that have lead in it, be a thing, but it's not something that I've seen. And again, I think those stamps of approval with like the USP or the CL or NF testing, they would probably look for that as like a contaminant as well.
Sure,
so
that's what they had said, to look for it on the bottle. What do you think about tea tree oil for pains, back pains and stuff? Have you ever heard of that?
I'm not something I've really seen, although it kind of has like a numbing kind of effect like menthol would, so it'd probably be relatively potentially more similar to like almost like a biofreeze, I would think. I know it can be used topically other places, for potentially pain. I guess it's not something I've really seen. Although I would say the risks of trying it would be low. So if it's something that interests you, it could be appropriate.
Okay, thank you very much. It was very informative.
Yeah, thank you for your question.
Thank you, Terry. And we have Jesse. Jesse Musicant has a question, so you can come off mute, Jesse.
Got it. Okay, I actually have two questions. The first one, I find it interesting if you're on, say, a bunch of medications and you read or you hear about a supplement, a vitamin, I've been finding very often the doctor doesn't know about all the interactions and it changes so quickly. Would it be more beneficial to go to a pharmacist who, I don't know, it's just a question. I was wondering who could give you a better answer.
Yeah, that's a good question. And some physicians might not know, and that's fine. It's not something that they might particularly use very often. So, in that case, I think pharmacy might be a very good resource for that. I've worked at a few different community pharmacies, and it might depend on what pharmacy you go to and how willing they might be to dive into and answer that question for you. But a lot of pharmacists I know would take the time to look at that. We're a little bit. A lot of pharmacies do have natural medication resources that we have more easy access to than physicians might. So, we can look those things up potentially a little bit easier. So, yeah, if your physician doesn't know, next step, definitely ask pharmacists. They might be able to help you out for sure.
Thank you. That's interesting. And I have one other question about fish oil specifically. I personally am very allergic to fish. And I had asked my allergist, if I take the supplement, am I getting fish per se? And he said, you could try it, but I don't know what'll happen. So is there natural something from the fish in it? Is it natural? Is it natural and from the fish?
Yeah, if you have a fish allergy and you're taking fish oil, it is from fish, so you could certainly have an allergy, and I would follow your allergist's recommendations with that. If he says that it's something you could try, it could be worth it. Otherwise, there are also other alternatives to getting some of those omega fatty acids, although not as ideal and you don't get quite as much. You can also get, let's see here, I'm just trying to pull it up.
One was nuts.
Like flaxseed or there are other alternatives to getting, walnuts or like canola or flaxseed, I guess, are foods higher in an alternative fat that's ultimately kind of converted into like omega-3 within our body. So there are other options other than just the omega-3s from fish oil.
Thank you very much.
Yep.
Thank you. Thanks, Jesse. Susan Henning, if you want to take yourself off mute, you are next.
Okay, great. Question on probiotics. I was reading on the internet that 10 to 30 billion is what you should go with for an adult. I was taking one that was only 100 million and it really didn't seem to do anything. And when I switched to the 30 billion, it really seemed to help.
Yeah.
Comments on that?
And it could just be, I feel like the 10 to 30 million is the dose that I feel like I've typically seen a lot for antibiotic use, like even within the hospital or anything like that. But, switching between two, I guess I'm not sure what different bacteria might have been within the probiotics, but it could have even just been the case of switching from one probiotic to one that has additional bacteria or something that maybe just worked better for you too. So, but I think usually the typical recommended dose that I feel like I've seen is that 10 to 30. But that's not to say that, taking the higher amounts isn't beneficial. So yeah.
Okay.
All right, Susan, thank you. I have a question. I've been taking acidophilus for many years, and it's kind of one of those probiotics that doesn't get a lot of hype. It's just, acidophilus. It's pretty inexpensive. What are your thoughts on that, Nathan?
Yeah, it's a pretty common probiotic. I think it's a good one. There is a particular brand of that probiotic that I personally recommend relatively frequently. So I think it's a very common and appropriate probiotic. As far as if it's better than other probiotics, that I'm actually not really sure of, but it's one that I would probably recommend over others for certain patients.
Great, thank you. All right, Susan Henning, go ahead. You're on mute, Susan. I'm sorry.
Sorry.
Could
Could
yeah.
you spell that, please? The one you were talking about with the probiotic? Could you spell
Oh,
it?
acidophilus? Go ahead, Nathan.
Yeah, it's like ACID, so like acid, OPHILUS.
Oh, okay.
So they do make like a refrigerated product or a refrigerated probiotic with that bacteria within it, which is the one I recommend. And most pharmacies will know what you're talking about if you ask for their refrigerated probiotic recommendations, and it'll have that in it. So
excellent. I didn't know that. All right. Well, we're looking at about 2:09. We want to make sure we get everybody's questions in. So if you have a question, please consider asking it. Going once, going twice. Okay. Well, it looks like you answered all of our questions, Nathan, and this was so thorough, and I took tons of notes. So I appreciate you being here with us and giving us some knowledge here. We are going to be sending everybody who is registered, even if they weren't able to attend today, we'll be sending them the link once we get it edited. We'll send them the link to this recording. So with that, I will say thank you very much for joining us today. And Nathan, I appreciate it again. And enjoy the rest of your afternoon.
Thank you, Nathan.
yeah, thank you for everybody for coming. It was a pleasure to talk with everybody. So.
All right. Bye, everybody. We'll see you soon.